of the signals that Workers' Day gives us is because it's the 1st of May, we're now going to move into much cooler, colder temperatures. I'm sure you've come across people who say they're suffering from colds and flu at the moment. There are many people who've found they're beginning to feel the effects of what is probably this year's flu virus. The National Institute for Communicable Diseases has said in the last week it hasn't seen much evidence of a flu epidemic yet, but it does say there's still cases of COVID-19 circulating in our communities, but that it is not causing a high number of people with serious symptoms. Dr Noluthando Nematswerani is the Chief Clinical Officer for Discovery Health. Dr Nematswerani, good afternoon to you and thank you for your time. I think we've all had the flu virus at some point and we keep having it. Why do we keep getting this virus? It seems impossible to eradicate.
No, thank you so much, Stephen. Thank you for having me. It is that time of the year. I think there are many respiratory viruses that circulate, but usually people refer to any type of respiratory illness as flu. And I think the NICD really released a good report that indicates that not everything that's circulating is flu, but we are getting into this flu season, which is obviously during the winter months. So that's the peak of the influenza season. But what we are seeing specifically with younger children, that there is an increase in the number of cases reported for the respiratory syncytial virus, which is RSV, because we are at the peak of the RSV season. There are also still some cases of COVID right now circulating and also some of the common cold viruses. So I think it's important for people to realize that not every cold symptom is because of influenza. And usually influenza symptoms are much more severe for some people, where you do get the body aches, the headaches, fever, and you do really generally feel very unwell. Whereas, with a general cold, you may have a scratchy throat, you may have a mild cough, and you will be up and about with a cold. So I think it's also differentiating between the various respiratory illnesses that usually are at play at this point in time. And COVID is here with us and it's here to stay. And it's, I think, fortunately, it's not really causing significant spikes in infections, but it is available in the environment in low grade. The influenza viruses are there every year and, different seasons at different severity of the influenza viruses. But fortunately, we do have ways of preventing these infections. And I think one of them being the influenza vaccine that is available towards the end of March, and it's currently available now in April. And we usually advise people to actually get these vaccines as early as possible to protect themselves from the virus, from getting the illness, and also preventing severe illness for those people who are high risk of getting severe influenza illness, like, they get pneumonia, bronchitis, and some people it really can be fatal. We do know that from the reports, around 11,000 people die in South Africa every year during the flu season. So the other ways, Stephen, that we could protect ourselves, I think we saw this during COVID, that the non-pharmacological ways of protecting ourselves are very effective. So if you are sick, avoid, coming into contact with others. When you do cough on your elbow, and making sure that you stay away really from work if you are ill, so that you don't spread the virus in the workplace, and washing your hands after you've touched your mouth. Some people use their tissues and, they blow their nose, and then after that, please wash your hands and wash them properly with soap and water. And if you don't have access to this, you can still use the sanitizers that I think most people are familiar with from the COVID time. I've said a mouthful.
Dr Nematswerani, there's so much more for me to ask. What's the difference between a cold and flu? And I think my wife would say she gets a cold and I get the flu. How can you tell what the difference actually is?
So there is man flu, just joking. So I think, for some people, so the common cold, like I said, it's usually the non-severe form of the respiratory illnesses that we know of. But there are some people who will have flu, but it could still be mild. So it's really sometimes very difficult to differentiate because of the similarities and overlap in the presentations. But the presentation that is much more severe, if you're feeling very ill, you've got muscle aches, you can't get out of bed, you've got fever, the likelihood of you getting of that being influenza or in some instances COVID is very high, unlike with a common cold. A common cold won't give you those severe symptoms.
There is a flu vaccine, and I find it interesting that we can't get rid of the virus, but you can get a vaccine. So how are people able to develop a flu vaccine that changes every year as flu mutates every year? What I'm trying to get to is, how do they do the vaccine before the flu actually shows itself?
So remember, the flu seasons differ. So we have the Northern Hemisphere and the Southern Hemisphere. We are in the Southern Hemisphere. So usually every year they will look at what's happening in the Northern Hemisphere countries and see which viruses are circulating and causing severe illness there. And usually then they will formulate our vaccines to protect us from those viruses that will potentially be circulating in that season in our hemisphere as well. So that's how they usually then formulate. I mean, ideally, we would want to get a vaccine that really protects across all seasons so that we don't have to keep repeating every year. But because of the mutations that you get with the virus itself, it becomes very difficult to get a universal vaccine that will cover us for a longer period of time. So that's why we have to get these vaccines every year to build the immune system to protect ourselves from whatever might be circulating. I mean, we've seen in other years where you find that because of whatever was seen in the Northern Hemisphere, then they do reformulate some of the vaccines that are provided to the Southern Hemisphere to ensure appropriate coverage. So, I mean, the vaccine is one of the most important ways that we can protect ourselves, especially, I think the most important group of people that we're talking to here are the high-risk people, because people with underlying heart and lung conditions, diabetic patients, HIV patients, pregnant women, children under the ages of 5, all those people are really at risk of developing very severe illness and being hospitalized or even dying from influenza. So I think it's important, but we're not saying everybody else should not vaccinate, because you might be staying with somebody who's in that high-risk group. So if you can also limit the duration of your illness, because you may not sometimes always be able to prevent it completely, but at least you limit the duration of the illness and you can protect your loved ones during that process.
I think, Doctor, what happens is that most people know what a cold is, and then when they feel really bad, they sort of take a day off from work and they go to bed. The dangerous situation really is knowing when you actually need to go from your bed to a hospital bed, and you may well be looking after a parent, for example, or an elderly person, when suddenly you think, oh, there's something serious here. At what point do you kind of know, are there warning signs that actually this person can't get better at home, they need help?
So I think the high-risk groups, people who are older than 65 and older, who have got these underlying chronic conditions and who do develop the respiratory illnesses, and you start seeing that they've got difficulty in breathing, shortness of breath, and all of those signs that really indicate that there is something much more serious happening in the lungs. Those are the signs that we would really encourage people to seek urgent help for. Just for the minor, because remember, like I said, even with influenza, while we know it can cause severe illness and death, even some people can get influenza and have mild illness. I think that's very important. We don't want everybody with mild illness, because they are in those high-risk cohorts, to now rush to the hospital. So we're saying once you see that the symptoms are getting worse, especially when you can see that it is lung-related symptoms, the person cannot breathe properly, the cough is really not going away. But remember, cough is one of those symptoms that usually lasts longer, even when your other symptoms like nasal congestion and other stuff has subsided. You find that the cough does continue to be there. But if it is associated with shortness of breath and difficulty in breathing, then we would advocate for people to go. But there may be other people who have got underlying heart conditions, where you start seeing that even their heart-related symptoms are getting worse. They are getting more swollen, and they're getting a blue discoloration, where you're worried that their heart is not really performing very well. So those are, indicators that that person needs to consult. So I think it's really just looking at the clinical picture and knowing the person that you're dealing with and making sure that you get help as quickly as possible.
And Dr. Nematswerani, I mean, obviously we had COVID-19, and before then there was a fairly predictable sort of flu pattern. The NICD has said we've sort of gone back to a predictable flu pattern. Do you see it like that you can almost predict what's going to happen?
I think we can, while we never really know exactly how the flu season is going to play out. But what we've seen is that, remember, we had that period during COVID where we actually had no, flu activity at all because people were wearing masks, socially distancing, and all of that stuff. And then when the flu season returned, it actually returned in a very, very unusual pattern where we saw some increased cases in December. I think following, the normalization now, where people then stopped using masks and all of that stuff, we are seeing that the influenza, viruses are now peaking during the flu season, no longer outside of the flu season. So I think that's the predictability that we're referring to, that at least this is following the normal patterns. We may not know really that whether the flu season this year is going to be bad or, it's going to be manageable, but at least we can predict that it is going to be during the normal expected time frame.
Dr. Noluthando Nematswerani, thank you. Chief Clinical Officer at Discovery Health. I really do appreciate the time today, ma'am.